Hey everyone, I just want to jump on and do a fairly quick video. I have my 2 doctor's appointments today. The first one was with endocrinology, so she just went over my blood work and everything looks good except for my TSH levels, or the thyroid secreting hormone levels. So they were at 5.280. So she's prescribed me levothyroxine, and I'm supposed to be taking 50 milligrams of that a day. So she told me to take it in the morning, 30 minutes before I have anything to eat. So that's pretty well normal. That's what I'm used to doing with the other medication that I have been on for my thyroid. The only difference is it's a smaller dose than what I've been on in the past. So that's good. I'm hoping that I won't experience any side effects from that. She said that because my thyroid levels are higher than normal, but not extremely high, she would say that I have either borderline or subclinical hypothyroidism. So what that would mean is I would still experience a lot of the symptoms that comes with having an underactive thyroid, which could include weight gain. It could include being very tired, just not feeling great. Like when you're moving, sometimes you feel really stiff. So I do experience a lot of that, and I have found over the last maybe 6-ish weeks that it has gotten worse for me. I also have a diagnosis from my days of doing infertility treatments of polycystic ovarian syndrome, or PCOS, and that as well can cause weight gain. It can cause insulin resistance. It can cause difficulty in getting weight off by yourself. So because I have both of those issues happening right now, she has also diagnosed me with what is called secondary obesity. So what that means is there's actually a medical cause or medical reason to why I have gained weight, and why I find it very difficult to lose weight, or why when I lose weight I suddenly put it back on, even when I'm not doing anything wrong in my diet, even when I'm following, doing my shakes, eating things properly, not eating a lot of sweets or a lot of salt, those kinds of things. So there is a medical reason as to why I am the weight I am. And of course, yes, I can do a lot better with what I'm eating and how much I'm eating and those kinds of things. So I am going to be very closely watching and monitoring what I'm putting into my mouth and into my body over the next couple of weeks while I'm on my summer holiday. So I'm going to be trying to be very aware of what I'm doing and what I'm eating. So after I seen the endocrinologist, I went and I saw my bariatric surgeon, and she's really nice. I have to say, and I have to commend doctors here in China. I feel like when you go in to talk to a doctor, they actually take the time to listen to you. It's not like you're saying something and they just go on and give you a script, or they sort of ignore what you're saying. They actually take detailed history, and they're interested in knowing how you're feeling and what you're doing and what's going on for you and those kinds of things. They actually really pay attention to what's going on with their patient. And I think that's very important, and it also makes me feel secure about having such a life-changing operation in a country that I'm residing in but not from. So I seen her, and she thinks, along with the endocrinologist, that the weight loss surgery is something that is very suitable for me. It's something that we should pursue, and it's something that will hopefully help me lose weight, of course, but it will also help me get all of my hormones back in to sync to where they should be. So that includes my thyroid levels, but it will also hopefully help all of my other just regular female hormones. So, like FSH, LH, those kinds of things. So hopefully to get my body working again the way that it should. So basically, I left the appointment. My doctor added me onto WeChat, which is the China Facebook platform, basically, and so she can keep in touch with me that way while I'm on holiday in July. And she's also going to be sending in all of the medical reports and the pre-authorization letters to my insurance today. So that can hopefully be processed over July, and hopefully I will be approved for surgery. There really is no reason why they shouldn't approve me. And that should then mean that I should be able to go through all of the tests that they want me to get done. They want me to do like an EKG. They want me to consult with nutritionists. I think they're going to want to do like a counseling psychology appointment, which is, you know, pretty smart. And as a counselor, I'm very much okay with that. And they're also going to want me to do like an endoscopy. They want to have a look at my stomach, at my liver, to make sure that it can handle such a surgery. And then we can book the surgery. So we're looking at probably the end of August or the beginning of September for surgery. So I'm very excited about that. I'm hoping that things will go smoothly from here on out. And I will keep you apprised of what is going to happen and what the next steps will be. Thank you so much for watching, and have yourselves a good day. Bye-bye.